Hey guys, welcome to Deeper. We're a vodcast about the Bible, theology, and Jesus. We want to be students of God's Word and God's world because the word in the original language of the Bible for disciple simply means student. What do students do? They ask a lot of questions. They have doubts. So if you have questions, you have puzzles about your faith, that's not just acceptable, that's encouraged. So we hope that Deeper is a space of learning. If you're a learner, this is for you. Wherever this finds you, whether you're in the car, doing chores around the house, out for a walk, wherever you are, we hope the next few minutes are helpful for you and feel like sitting at the feet of the world's greatest teacher, Jesus of Nazareth. My name's Ryan John Gregg. I'll be your host for today. And I'm sitting today with a special guest, my friend and also my sister, Dr. Kate Long. Kate wears many hats. She's a mom, she's a wife, she's a member of the Bay Church here. But the reason we're talking with her today is that she's also a doctor of public health and is a research scientist at Harvard University's Human Flourishing Project. And she is a real professional in terms of the data and the secular metrics for thinking about what health looks like at scale for communities. So here at the Bay Church right now, we're in a series called The Great Compassion, joining God's mission to heal the world. And we've looked at how God's desire for new creation, for resurrection life, translates into our task. And today we're going to talk about how that mandate comes through in the world of public health, in certain secular circles, how that overlaps with faith. So this is going to be a rich conversation. And so Caitlin, welcome. Kate or Caitlin, she goes by both. Caitlin is my big sister, older than me by 2 years. Yep. We lived together in Boston for several years in the same house when we were both in grad school.
Yep.
And she is a true mentor and friend and all-around beautiful human being. So
thank you.
Welcome. You're a doctor of public health, but that's not where you started out.
No.
As in your journey. So can you give us a sense of what led you to public health? And while you're at it, what is public health? What does that even mean?
That's a very good question. Yeah, this is a real joy to be here today, and I'm going to try not to be too sentimental. But okay, so how did I get into public health? Well, I actually started when I went to college. I studied, I was in religious studies and really loved it. Loved my coursework, loved what I was learning. I was minoring in music. It was like full throttle theology and music. But ever since I was a little girl and all the way through college, I've always been, like many of us, really troubled by suffering, particularly physical suffering in the form of poverty. And in college, I started to volunteer on Skid Row in LA. That's where I was down going to school. I also had a chance to work overseas and see how poverty plays out in all different contexts. And there's some aspects of it that are really unique, and then there's some that feels very universal, particularly how it can affect so many parts of a person's life, and not the least of which is a sense of dignity and meaning and hope about what the future holds. And so these are the kinds of questions I would honestly bring into the theology and into my classrooms and be working through. And I didn't even realize it was such a focus until I found myself gravitating more and more towards work that would put me in direct contact with people living in poverty in different ways. About that same time, I started dating this great guy who I ended up marrying, and he understood. He was troubled by a lot of the same things I was troubled by, and he was very clear that he wanted to study medicine, and he knew that to be a good doctor to patients, it was going to be a very long road for him, that he'd have to go to med school, and then he'd have to go to residency, and even as a young doctor, there would be certain boundaries on his practice, and yet he was willing to do all that training because he wanted to really be able to help people in a big way. And that inspired me because I was a little bit more like a jump in and let's go at that point. And yet I was struck by the idea that there's a science to this. There's an art to it, and it's not necessarily a sidetrack from our call to go and study and learn and really sit at the feet of experts about how you can care for people well, how you can look after physical needs well, how you can understand the needs of communities and really work alongside people to bring about greater health and greater well-being. And so that that really brought me into the field of public health, which you asked what that was. And I think one way to think about it is what helps populations be healthier and what helps prevent illness and suffering. So public health is best when we can prevent disease and suffering. Mm-hmm. And a lot of the early gains across the 20th century and even prior to that were efforts around clean water, food safety, different kinds of medical treatments that would prevent illness from ever occurring. And I think that that's a really beautiful way of thinking, not just how do we help people when they've already gotten sick and suffering, but how could we even prevent that? And so I started at first in a master's program, and then went forward through to a doctoral program. I worked along the way. Paul and I were doing all of this together, and so I had years where I would, work in the real world and then come back to school. And I guess in my heart, I always thought that public health and my love for the church and work in the church would be somewhat separate, that I wouldn't actually formally do the two, that maybe I would do some translation and, say to people I knew in the faith-based world, like, hey, this is how, public health academics are talking about this, and then maybe do some translating of church work in the public health world. But as I went forward in my training, those two worlds crossed more and more. And I think it's because these are things I'm naturally drawn to think about. And so, of course, I think about them in the overlap. So I ended up studying faith-based hospitals as my doctoral dissertation, and really looking at a lot of hospitals that were built as a missionary effort, decades ago, in some cases centuries ago, and what happened over time to those hospitals, and how those hospitals, many of them, continue to stand today, now under national leadership, and continue to fill needs in the community that are unique and that complement efforts that maybe the government's undertaking or for-profits.
And this is in India.
Yes. So I focused. The core focus was on India, but in the course of doing that, I also looked at the global landscape too. How many different countries the faith-based work, mission hospitals continue to do a pretty big lift when it comes to healthcare delivery and public health efforts.
Is it true that the very sort of the institution of a hospital is more or less a Christian innovation? Is that true, or is that stretching the truth?
It's stretching. I mean, there's different religious contributions. Muslim hospitals made a big contribution in that as well. But Christian charity and institutional Christian charity was really an innovation. And Christians from the beginning have really lived out their commitment to Jesus in being for the poor and being for those who are sick and suffering. So even before hospitals, just the act of caring for those who were suffering with plague, who were outcasts of society, abandoned children in particular. And so these kind of extravagant acts of love and mercy really stood out against ancient culture. And, not always done in ways that like totally jive with 21st century sensibilities, but in ways that are really profound and really were a pretty big witness in ancient times. And so the modern expression of those kind of continue that family legacy in a way and continue to do it really beautifully in a lot of contexts.
So one of the things this brings up for me, and I think for other Christians, is the question of, are Christians the only ones doing good work in the world? Did we invent kindness? Do we have a monopoly on compassion? And it is the case, as I think you've discovered, that in the secular world, which is not monolithic, there's great variety within it, that there's different visions of the good, people trying to do good. So can you comment, just help us understand what you've encountered in terms of alternative models of the good?
Yeah, that's a great question. I mean, one of the things when I started studying public health, in secular university context, was just really being struck by the extraordinary commitment I encountered amongst my professors and my peers to working for good, working for justice, and doing it in a way that was thoughtful, that was aware of itself. One of the things that kind of blew my mind, because when I started public health, I was just so foreign to health science and research methods. But every paper you write has to have a section on limitations, on what we don't know. So you do all this work and you've written this paper and you're putting all this into the world, but then you have to say what you don't know. And and what other kinds of work would make this work better. And I really was struck by the humility of that and the way that there were so many people.
But couldn't you see it as just job security? Saying, here's where I'm going to get my next grant?
Yeah, and it turns
Sorry.
out we are answering
Cynical.
that question. Yeah, I mean, there's all sorts of maybe ulterior motives that fall into that. But really, truly, I was struck by how hard people were working, how diligent they were, the kind of self-reflection that took place, like asking, did the program we just promoted at the community level, at the national level, sometimes at the international level, did it work? And if it didn't, why not? And what did we maybe do that was incorrect? And how can our next set of policies or programs learn from that? And that doesn't seem very like jaw-dropping, but for me it kind of was, to see that level of reflection and practice exercised at scale.
And you did some substantive work in various parts of Africa as well, right?
Yes.
Where in Africa?
So largely sub-Saharan Africa. And, there, the great privilege was working in public health care facilities that started as HIV clinics. But due to the advancement of science, these clinics were not, they were really built with the idea that patients were going to continue to die prematurely. And so they never really planned to build facilities that could handle large patient volumes. But what happened was, we have come up with beautiful treatments and effective treatments to help people live longer, so long, in fact, that they now have other diseases they need care for. And so I was watching these clinics just bursting at the seams with people who were still needing treatment for HIV, but also needed treatment for diabetes and hypertension and all these other sorts of things. So one of the adages in public health, one of my professors would say, no good deed goes unpunished, meaning you make the progress you hope to make, and now you have a new set of challenges. But in those clinics, I encountered people of many faiths, many backgrounds, but I also encountered Christians. And I blew my mind one time. I was working in one of these clinics with all these really young African dedicated health professionals, and I go back in the cold storage room, which was also kind of like the hangout room, and they're blasting Christian worship music.
Wow.
And I don't think at the time they expected someone from Boston to come in and be like, I know this song. I'll sing this with you. And so there was just this instant family connection that we are here out of our professional, our vocational commitments, but we're also here out of a love for Jesus. And that you see that just all over the place in our country and globally. It's incredibly humbling. And I think it's a really good practice to work alongside people of many views, many faiths, and as far as we can go towards common goals, let's go there. And as teachable as we can be to other ways of thinking and doing, let's do that. And in that humility, we will get better, and I think we'll be more clear about who Jesus is asking us to be and what kind of work in the world he wants to do through our lives. And so we don't need to be as afraid. We can have a little bit of courage.
I've heard you distinguish before between common goals and common visions. Or
values. Yeah.
Can you talk a little bit about what that means?
Yeah. So, sometimes when we're talking about partnerships between people of faith and, the secular world or whatever, some people, I think, call for, we need to have shared values. Like if we all have ultimate, if we're all sharing values, we're going to get where we need to go. And I say, and many others have said, that's not realistic. We live in a pluralistic society, in an incredibly diverse world. You can't even get most Christians to agree on all the things. So what makes us think that we're going to all share ultimate values, especially when we're talking about different kinds of collaboration? But we can share common goals. Even if our motivations are different, even if our kind of like fundamental commitments are not the same, we can still work towards things together. And in that work, we might build new kinds of friendships, and in those friendships, we might need to have new kinds of conversations, and that's a much more hopeful way to proceed. It's realistic, and I think it's more hopeful and healthy.
Just in the room right over there at the moment is a gala for the food bank going on right now, right?
Yes.
And that's an example of us trying to work towards common goals
and
with some people.
Fabulous. We care a lot about food security at our church. We're active in that every week. So why not open doors? Come on in. Teach us the best of what you have to teach us. I think I think Christians should be the most curious because we serve a good God. So and he's not just at work in our little church and in our little hearts. He's at work in the world too. And if we get out, we smell that, it becomes a really it becomes a way of living that's actually filled with a lot of hope.
Yeah. So let me return back to your story and balancing Christian ways of approaching injustice, pain, suffering, what's wrong with the world, secular ways. You know, Christians, we're storytelling people.
Yeah.
The Bible is a book of stories. And secular communities tell stories too, but the architecture of those stories is data driven. And so can you talk about the relationship between Christians and data? And yeah, just throw it there. Okay. Christians and data. What do we say about that?
Well, I think of data as really just another way of telling a story. You know, I think there's many ways to tell stories, and the more the better, because you get more nuance, you get more texture. You probably will run up against things you don't understand and you have to wrestle with in a way. I also think of data as another language, and I have to say it was incredibly humbling, my first rounds of biostats and epidemiology, because I just was a complete fish out of water, not just learning the principles and the math, but also the coding. There's a lot of statistics software you use, and you're like, you know, I used to go practice the piano in the basement at Vanguard, and now I'm, you know, up in the computer lab trying to figure out where the heck the parentheses goes so that my code will run. And it's just really humbling. And suddenly everyone just seems brilliant around you. And
that's hilarious.
And I still kind of have that posture towards data. It's something I have to work at, and something that I think is both an art and a skill ultimately. But I've seen many times over how data, when used well and when complemented often by good stories and rich qualitative data, can really paint nuanced pictures and deepen our understanding and create new ideas.
Better questions.
And better questions, exactly. I mean, best methods often are the blend of the two that are stacked. So you ask good questions and you go get some data, and then that makes new questions and you get more data. So it's a way of knowing. It's there's often ways there's also ways that data can be used poorly, or can, you know, be masked in some way. You sometimes see that in the headlines where people scrub their data or omit parts of data that would give you a bigger picture. So it's not a silver bullet, but I think it's a really powerful tool in the tool chest if we use it well.
Yes, I think that feeds into some popular suspicion of data.
Yeah.
Because it's like, well, I don't know how you're framing those statistics, and you may be just making them say what are your predetermined conclusions.
Yeah.
So, but this is the point of the rigorous process and peer checking and being exposed to critique.
Yeah.
And so that's a humbling, but that's virtue. That's
it
a virtue.
Yeah. When you publish in academic literature, you go through a process called peer review, and it's people that you've never met and who oftentimes it's blinded, so you don't know who they are, and they sometimes can rip you to shreds.
How glorious.
In a way that can make you laugh or cry depending on your mood. So that process can be a little jarring at first.
Yeah.
But ultimately, it's like if we can receive that as not just criticism of me, but a way of taking and making my ideas better or more clear. Or oftentimes reviewers will say things and I think, I truly didn't think of that.
Yes.
That is so helpful.
It's a gift.
You hate my guts, but you just made this paper so much better.
Right.
And, you know, again, it can be just another way of telling a story, another way of learning, and another way of serving and serving thoughtfully.
Let's come to your specific work that you do. So for the last few years, after you finished your doctorate at Boston University, you pretty immediately joined a group that was just starting up at Harvard called the Harvard Human Flourishing Program.
Yeah.
And it itself, to my understanding as an outsider, is catching a wave in a new movement in health circles and also psychological circles to say, hey, we've studied for a long time what goes wrong.
Yeah.
Maybe we should study what it looks like when things go right.
Yeah.
And so this produces positive psychology. You earlier defined health in terms of defense, preventative. Let's stop this, and this. But what is the positive content of health?
Yeah.
And how do we promote that?
Yeah.
So can you, twofold question, can you comment a little bit on flourishing as a topic and as a positive vision of health? And secondly, can you give us a sense of what specific projects you're pursuing in the moment, how they might contribute to the church world and beyond the church world?
Yeah, absolutely. So you're absolutely right. You know, there was so much work, and it's important to never fully ignore suffering and death rates, and particularly mortality when it comes prematurely, morbidity, which is illness. Those things all really matter, and those we need to stay attentive to those. But in concert with that, we could also be thinking about and asking, well, what makes life worth living in the first place? What gives life meaning? And there's different visions of that. In our group, we use a framework that was put forward by my boss, Dr. Vanderweel. And
what's his first name? What's his full? Tyler Vanderweel.
Yes.
Okay.
And so
total baller.
He's a very, very smart guy and a very good man, and it's been a privilege to work with him. Mm-hmm. And he put forward a framework in 2017 that described flourishing as really a culmination of 5 domains in a person's life. When these 5 domains are going well, we can say that more or less that person is living a flourishing life. And there's all sorts of qualifications with this. Sometimes you have to just simplify in order to start. But those domains are happiness and life satisfaction, physical and mental health, meaning and purpose, character and virtue, and close social relationships. And those 5 domains are really pulled out of empirical literature, or this scientific peer-reviewed literature, where there's actual studies on these things, and looking at how those kinds of outcomes lead to flourishing life. But he did a second piece of this framework, which is, well, what pathways get people to better mental health and physical health, to maybe a deeper sense of meaning and purpose? And he identified 4 common pathways. These are not the only pathways that are held in common across culture and context, and they are family, work, education, and interestingly, religious community. Mm-hmm. So when there are healthy structures in those parts of people's lives, they are more likely to flourish in the 5 domains I mentioned. Mm-hmm. And that framework has really given us like a scaffolding to say, okay, now let's go look at the data and learn more about the relationship between, say, religious community and physical health or mental health or different forms of well-being. And really interestingly, there's these big data sets that exist that are not designed to ask these questions, but you can use the data to look at these kinds of questions.
Right.
And so a lot of the work started with looking at what happens when people participate in religious community more frequently. Mm-hmm. What happens when they go to church? Mm-hmm. And most of these studies are done when asking people about church in person. This was really before the virtual church movement took off. So it'll be really interesting to see how the data plays out. But just significant reductions in depression, in risk of suicide, in risk of death overall, lower rates of divorce.
Indeed, we live forever.
Yeah, exactly.
My death rate's gone way down.
Lower rates of adolescent depression, illicit drug use. I mean, it's pretty incredible the kinds of things that happen in a person's life. We would say in addition to all the other good things that happens in a person's life when they attend religious services. But it was just a way of using, as we talked about earlier, using data to explore questions that have a lot of value and can maybe give us answers or tell us answers we're familiar with, especially as Christians. The idea of going to church is like completely not novel.
Right.
Okay. But when you look at it through this lens of data and these kinds of things, it almost makes it fresh again. Right. And we realize, oh, well, we're not just blowing smoke here. There's actually value in what we're doing, and there's spiritual value, but there's these other kind of knock-on effects we might have not thought about before. Right.
Can I circle back to a couple things here
before
we get to the second part of my question, which is specific projects? So one, from a philosophical angle, we're in the neighborhood of what people in my field might be wary of as a sort of reductionism, to say, oh, well, religion's good because it works. Yeah. It makes you feel better. So it's a functional thing. Yeah. It's but philosophically, theologically, turn it around and say, no. It's not true because it works. It works because it's true. Mm-hmm. It's tapping into something greater than. Mm-hmm. And so I think that that's a fault line in the way that Christians would interact with the findings and the deeper unstated frameworks of secular frameworks of health. The second thing I was going to say, I want to circle back to what you said at the beginning. In those 5 pillars that Tyler Vanderweel outlined, I'm fascinated that one of them is character and virtue.
Yeah.
That's different than meaning.
Yes.
Meaning is like, I've got a goal. I'm,
Yeah.
but character and virtue. So that suggests if I'm hitting on all cylinders in other areas of my life, but I'm a schmuck, but I have no character. I do really bad things, but it's working out great for me.
Yeah.
I got great friends.
Yeah.
Things are going great.
Yeah.
That somehow I'm still not flourishing. That's a fascinating claim to me.
Yeah. So I'll comment on that first, and then your other comment. But one of the unique parts of our program is that we have a staff that's full of people from a lot of disciplines. So we have people trained in public health and in kind of quantitative methodology, but we also have philosophers and theologians, sociologists, psychologists, and others. And I think that work, that reflection on what makes for the good life, I mean, the discussion of virtue is a very ancient discussion.
Yes.
And sometimes we forget that in our modern moment, and we almost like are perpetually rediscovering the virtues. And the ancients would like roll their eyes and scratch their heads at us. But reintegrating that into modern conversations of flourishing and the good is really important. And it doesn't just privilege numerical data, but it also privileges historic data and historic dialogue and theological dialogue, and says these are also ideas that matter. And we want to explore them with our modern methods, but we don't want to just like shoo them away because they're old, some of these ideas. So yeah, it's kind of been integral from the beginning. Can you remind me of the first thing you mentioned? I'm forgetting.
I mentioned reductionism.
Oh, reductionism. Yeah. So I helped teach a course at the Harvard School of Public Health on religion and spirituality. And one of the cautions we have to make often when secular people encounter this content is that it is not to say, awesome, let's go do our health campaigns in churches because people trust them, and if they go, they'll feel better. It can be very reductive, and that's very offensive, and it doesn't make for good partnerships. I mean, people can smell it when
that's cute. Like, you believe in that?
Yeah. It's like, your ideas are really special, but could we use your, whatever. So, yeah, I think that's just a constant place of not even just caution, but just awareness that, especially when we're explaining these kinds of effects in diverse settings, people will gravitate to the thing they understand. It's like, okay, religion can be good for you in these ways, but most religious people do not go to church so that they have like a longer physical, literal life, years lived. And they don't go to church so that they won't commit suicide. They go for other reasons. They participate in other reasons. There are profound ideas that are shaping souls and minds, and it is that draws people. And this is maybe just an elegant segue to the second part, which is what our program's really trying to explore, is looking at some of these things. So not just the physical act of participation, but what does hope do in a person's life? Can we measure hope? Can we understand how when a person has hope, in 2012, what happens to their life 6 years later, 10 years later, whatever? Same thing with forgiveness. And many of these kinds of ideas, we're working on projects around love. And what does it mean? What happens to a person when they truly love their enemy? And again, old questions, but I think we can approach them with new methods. And I think we learn a lot by taking old questions and looking at them in a different perspective. And I will just say, we see some really incredible effects on physical health and particularly psychological health in the domain of hope and forgiveness. When we exercise and practice forgiveness, it changes us for the good. It impacts us for the good. And that's pretty remarkable.
Yeah. I mean, again, as an outsider, looking at some of the tropes from the mindfulness movement and the need for compassion, for gratitude, for empathy, these kinds of things, and the science behind them. And a lot of it, as someone who spent a lot of time in the ancient world, it's like, well, you're just catching up with what's already been long known about human beings, which is not to discount the genuinely new findings that are happening, but just to say there's a holistic agreement between these things.
Yeah.
If you dip into the interdisciplinary spaces where you hang out.
Yeah.
Let's come to some of the stuff you're doing here at the Bay Church. Or did we get to your specific projects at the Flourishing Project? Okay. All right. So here at the Bay Church, one of the things you do is you help lead our shower trailer ministry, where we have a retrofitted trailer with 4 hot showers and go to places where people need that.
Yeah.
Can you comment, just tell us about your work with that and how it links up in your mind with public health, with compassion, and also with the kingdom of God? Can you just riff in that direction,
Yeah,
if you
okay.
would, please?
Yeah, so it's been a real privilege for Paul and I together to lead the shower trailer and serve with a incredible group of volunteers from our church, incredible leaders, and to really get to know our friends and neighbors in the community who are unsheltered. And we serve at 3 sites each week, and some of the guests we serve, they just come once and we never see them again, but many come often. And it has just been a gift to get to know them, and to serve one another, truly. I think about what we talked about in church this last weekend with John 13, how Jesus washed the feet of the disciples, and then he said, now you wash each other's feet. You go forward and wash feet. And I think what's really powerful is it's not just us giving showers to other people out there. There is a real circular way that service functions and compassion functions. And there are many weeks where our guests who come to the shower will bless us in extraordinary ways and show us the love of Christ in ways that we might have needed that day. Same thing with volunteers. We're not all just shoulder to shoulder but not looking at each other. Like, we are serving each other. We are encouraging each other, spurring each other on towards love and good deeds. And honestly, doing it week in and week out, which is very sanctifying in a way, because there's some awesome weeks. There's some really not awesome weeks. There's some hard, hot days or hard, rainy days. And then there's fantastic days. And, I see it as obviously quite different than the work we were talking before, but in some ways really not. It's using the tools God has given us to serve and to be at work in the world for good and for the building of God's kingdom. We live in this now, not yet moment where we are not perfectly restored. We do not all live in a resurrected life. Everything is not going well. We see evidence of injustice and brokenness all around us. And yet, we are also a hope people. We're a resurrection people. We live in the light of the cross and in the glory of an empty tomb. And that starts now,
Yes.
So that gets me going.
Amen.
Yeah.
Well, I mean, it's a window to the fact that for you, this is more than just theory. It's more than just interesting ideas. It's something that has been a heart pulse for you for decades now. Yeah. And it's been so amazing as your brother and friend to watch it mature and scale, and even having been with you through a lot of the years where you're in your basement, like.
In my lazy boy.
When you're grooving to instrumental chill music and pumping data sets, but that it's in service to these deeper passions, these deeper convictions about the kingdom of God, about that now but not yet. What does it mean to get in the harness and pull towards resurrection? Yeah, and that's ultimately that's what in this teaching series we're trying to help people understand, is that at the end of the day, doing works of compassion is resurrection work. Yeah. And it's incredibly embodied. It's practical. It's real. Yeah.
And it's every one of us. You know, it's not a just those people who did, whatever training. It's every one of us. And it's not just doing it is important to scrub the showers, I will tell you. But God has given each one of us a unique set of gifts, abilities, skills, curiosities, dreams. And if we follow that through and we trust God with it, He will use it in ways we can't imagine. Right. And that's a day in, day out trust exercise. But I think if we all really took God at His word, that He loves us and wants to work in and through our life, we would be blown away at how He can work in every sphere. And sometimes we get to do it together as a church family and serve shower trailer or food market or whatever. But most of the time, it's going to be Him working through us in our everyday lives, through our families, through our work. And I find that to be a real joy and a gift and a hope. It fuels me with hope for what God is going to do in the world.
Well, thank you, Caitlin. This has been very, for me, just inspiring afresh to talk about this. And I'm grateful for all the offline conversations we have about this stuff. And thank you for the work you're doing. And so, guys, thanks for joining us today. I hope you found this as helpful and interesting as I did. Deeper is a ministry of the Bay Church. We're in San Francisco Bay Area. And we'd love to see you sometime at one of our services, either in person or online. You can find out about us at thebay.church. And until next time, be well, be healthy, and as the rabbis say, shalom, homies. Bye-bye.